Hello, how are you doing today? Well, that's great. My name is Dr. Quiet. What's your name? Okay, so I see here that you are just in for a little bit of acne treatment, is that right? Okay, great. Let me just get your name down here. And what did you say your last name was again? Thank you. And what is your date of birth? Okay. All right. Well, before we get started on the acne treatment, whenever anybody comes in, I like to do a general assessment all the way around their head and their skin areas, the neck, the ears, the skin underneath the hair on the scalp, just to make sure that there's nothing going on that maybe you haven't noticed, okay? All right, good. So first I'm just going to go ahead and get these gloves on. And once I get these gloves on, I'm going to just do a basic wash on your face with a wipe. It's got just a little bit of rubbing alcohol on it just to get any dirt, debris, anything that you might have left on your face. Just the residuals from the day. And then I'll start with the general assessment and examination. And once we go over that, we'll go over the acne treatment, okay? All right. Do you have any questions for me before we get started? Okay, no allergies or anything like that I need to know about? Okay, good. These are latex gloves, so if you had a latex allergy, I would make sure to get some different gloves. All right, let me just get this disposable wipe. They're individually sealed, so no contamination. So I just want you to relax, close your eyes. I'm just going to be cleaning off your face. Just nice, gentle strokes. On your forehead. Chin. I'm going to go up under your jawline a bit. Just let me know if it's uncomfortable or anything. It shouldn't be. I am going to touch on your ears just a bit. Just on the outsides. And now on this side. Again, if anything is ever uncomfortable, you just let me know. Get behind there. Alright. Now we got a little bit of debris off your face there. I'm just going to throw this away now. Now I'm just going to be touching your face just subtly. I'm going to be feeling for any bumps or lumps. Looking for any contusions that shouldn't be there. Any asymmetry. Fine. I do see the occasional freckle. No worries there. I'm not feeling any bumps or lumps on your Nothing on your forehead or your hairline looks fine. Okay, look up for me. Thank you. I'm just going to be feeling on your neck here. Everything feels just fine. Lymph nodes. Not seeing any excessive marks on the skin. Okay, I'm going to be looking at your ears now. I'm not going to be going inside your ears. I'm just feeling around the lobe, the exterior, just checking the skin, and also assessing where you might need all the acne treatment to be focused. Okay, I'm just going to pull your ear back. Okay, everything feels fine on that side. And again, just the same thing over here. Just checking the skin, feeling this lobe and all the cartilage, making sure there's nothing on the skin that doesn't belong. Alright, I'm going to be pulling back on the ear now. Just feeling all back there. Alright, that's just fine. Alright, now I am going to go over your scalp a bit, around the back of your neck, just to make sure that there are no lacerations or problems on the skin that your hair might be covering up, okay? Alright, I am just going to be getting into your space again. Yeah, you just relax. Yeah, I'm just mostly feeling around your head, behind your head, underneath, right on the nape of your neck. Just making sure there's nothing in there that you don't know about. So far, I'm not feeling any lumps, bumps, lacerations, contusions. Everything seems just fine. Okay, now I'm just gonna kind of look around this area just a little bit. Kind of just see the extent of where I need to start and end the acne treatment. Alright, so everything seems just fine. You do have just a little bit of acne, but it's totally normal. I'm just about convinced that everyone has at least a little bit of acne, and it's very easy to take care of. There are many different topical ointments today and various treatments that people like to use. For more serious cases, some people like to use laser treatments, but generally speaking, a general dose of Retin-A or something like Retin-A will help clear up that acne. But while you're here, what I'm going to do is I'm going to take another treatment to your face with just a cotton ball. It's a very light treatment. It's just going to help open up those pores. And then I have this solution here. It's been heating and it's warm. It's just got some minerals and good stuff in there. With this rag, it's going to rest on your face. It's going to give you a nice steam. It's going to open up all those pores. And that way, when I start doing a little bit of extraction, it's going to come out super easy and it shouldn't hurt you, okay? All right, let's get started. First, I will wash my hands with this Pure. I like the gloves for the general examination, but I want the dexterity of my hands for this segment. Okay. So we're going to start off, like I said, with cotton balls in this very light treatment here. So just one cotton ball should do it, since we've already cleaned most of the impurities from your face with that first wipe. I'm just going to lightly rub this on your face. It might sting just a little bit on any areas of redness. So if you have a little open place, it's going to sting just a little bit. But if it gets really badly uncomfortable, painful, please let me know, okay? All right. Yeah, I am going to be putting a bit more pressure than I was with the first wipe. I need to be very thorough so that the formula will get into all of the pores. Alright, I'm going to get up on your forehead now. Yeah, I need to get in the hairline too. It won't hurt your hair, I promise. Okay, move over to this cheek. How does that feel? Is it burning or uncomfortable? Okay, wonderful, good. I'm glad it's not stinging or anything like that. Yeah, some people, they take to it better than others. Okay, I'm going to apply a little bit more. Then we're going to get the chin, the nose, and we're going to get under your jawline a bit. That seems to be your main problem areas. Although your face actually does look very nice. It's just a light problem. Alright, if you could just look up for me. Thank you. Yeah, some of us do get a bit of acne problems under here because you don't really notice it. You don't see it every day unless you're making a point to look at it. And just look straight at me, and I'm going to get around your eyes and your nose and the front of your cheeks here, okay? Just keep your eyes shut and your mouth closed. Getting under your eyes. Yeah, I'm always very careful not to get this in the eyes. Alright. Okay, you can open your eyes again. You may feel just a little bit of the vapors coming across the eyes, but it shouldn't hurt. Just maybe a little uncomfortable for a moment, okay? Alright, great. Alright, throw this cotton ball away and put these up. And I do have one more thing I want to do before we start the steam on your face. I have this special lotion here, and this is going to help the steam work faster. sometimes the steam can take a while, but I know that you don't have all day today. So I'm going to do the process that speeds it up, okay? Alright. Nope, this won't burn at all. And it does have a light fragrance. Are you okay with the fragrance? Yeah, it's not very strong at all. I like it. Here, you can smell it. Oh yeah, I really do love the smell of it. And this is not going to go over your entire face. I'm just going to be focusing on the biggest problem areas, mostly in the T-zone here. And I think for you, I am gonna do a little bit on the cheeks here, a little bit on the chin and jawline. Okay, those are the areas that I think are gonna need just a little extra help. Okay, and I am just going to apply this directly with my fingers. Just a little bit. On the forehead, then around to your cheeks, right on the nose, and if you look up for me just a bit, yeah, get it right on that jawline, just spread that in until it disappears. Perfect. Okay. Now, I'm just going to soak this rag here, and this is mostly just water. Just nice, hot, steamy water. Because the steam and the warmth helps open up your pores. Will lead to a much more comfortable acne treatment. Okay, so I'm just going to wring out this rag over here. We don't want too much water in it. I'm just going to sit this right here for a moment and let it air out while I close up this lotion. And now I just want you to relax. Close your eyes. And I'm going to place this nice, warm, wet rag right over your face. I'm just going to press it on there. Are you comfortable? Are you able to breathe okay through the rag? Okay, good. Yes, just breathe normally. That's just going to sit onto your face. I've pressed it on there, so it's just going to stick right there. And that, combined with the lotion and the steam, is all going to combine to warm your face, relax you, open up those pores. Yeah. Yeah, it's very relaxing. When we do the full-length treatment, sometimes people fall asleep during this part. Yeah. Yeah, the lotion speeds it up considerably. But yes, while you're sitting there, I'm just going to continue kind of touching it onto your face, making sure there's good contact. Alright, not too much longer. Like I said, this is the shortened version. Okay, I'm going to start slowly peeling this back from your face. Do you feel fresh and rejuvenated? Do you feel ready to get rid of some of those blemishes? Alright, great. Let me just put this away to be washed. Alright, so today I am going to be using a couple of different tools to extract the whiteheads and the comedones. Comedones is just a fancy word for blackheads. So I've got your typical everyday tweezers here to help me extract things that I've already gone through. And then here I have the comedone extractor. It's got two different ends. One works better for blackheads, one works better for whiteheads. Okay. Since we've opened up those pores, you will feel some pressure, but it should not get painful. And if it is painful, let me know, and I will move on. We'll start with the retin-A, and I'll prescribe you a bit of ointment that will help keep your face nice and loose for the next appointment. Okay? All right. So let me go ahead and put my gloves back on. A fresh pair. Before I get started, I'm going to get out my light. I'm going to have a close look at your face. And I'm going to determine which blemishes are ready for extraction. Right, I cannot, or I should not, extract all of them because some of them might not be to the point of needing extracted yet. And I do not want to be leaving any scars. That's what we are trying to avoid and get rid of, okay? Alright, so let me just, here we go. Just check out. Yeah, I can really see all the individual pores this way. I can definitely get a better idea of which ones I should focus on, what I should skip and leave for the next appointment, and what might need a lot of work before we get into it. It doesn't look like you have any cysts or any big bads like that. Looks just like your very typical everyday acne. If you could just look up for me, I'm going to check out your neck area. Alright, thank you. Alright, along this jawline, there's a few that I think we're going to work to extract. Today we'll do that. Okay, and on this side, about the same, yeah. I'm just gonna look into your eyebrows. That can be an area where they like to hide. Okay, and I'm just gonna take a look again behind your ears. Alright. That looks pretty good in there. Yeah. And on this side. Yeah, that one's pretty clean too. I think we'll just leave the ears out of it for today. You might want to put some of the topical ointment in there, though, to loosen some up for next time, alright? Okay. Alright, now I'm just going to do one extra look right on your hairline. I noticed there's a few little problem areas. Very common. The oils from the hair often cause problems right along the hairline. Okay. yes, this treatment won't affect your hair negatively. It will be just fine. All the ointments that I prescribe will be fine. Alright. Looking good. Yeah, it's really very typical. There's nothing to worry about. You do not have any cysts that I noticed, no pilar cysts in your scalp, nothing that needs to be nicked, a little extra to be extracted. All of these are going to be really easy. They should come out right away since we did the steam on your face, okay? Alright, let's get to it. So I've got my tweezers here. I've got my Cobanone extractor here. And I have some tissue here. So we're going to use the tissue to finish extractions and to clean off the Cobanone extractor, okay? Alright, so I am going to start right on your forehead, right along that hairline, alright? Okay, just relax and let me know if it's too painful, okay? How is that feeling? Does it feel okay? Yeah. Yeah, it's mostly whiteheads through here. I was a little concerned at first that they might be milia, but they aren't. They're just your average, everyday whiteheads. Milia, they're a bit harder to extract. I mean, essentially they are whiteheads, but they're almost like little rocks underneath the skin. Well, your face is going to be red after this extraction session, but that will be temporary. There won't be any scarring, especially with the ointments that I'm going to be prescribing for you, okay? All right. Okay. I think that's all the ones that I want to get for your forehead. So now if you'll just look up for me, I'm going to start on that jawline. And now these are a mixture of comedones and whiteheads. Again, they do kind of look like milia, but they're not giving me any trouble at all, so I know they're not milia. They're just whiteheads. Look up, please. Okay. Yeah, this one's giving me a little bit of trouble. Does that hurt? Just pressure. Okay, perfect. Okay, alright. Now on this side, there's a lot of blackheads, so I'm going to be using the other side of this extractor. There weren't very many on that side. If you could just, do your face like that. You've got a couple right in here that I'm gonna take care of. Okay, no pain? Okay, good. I don't want there to be any pain. Okay, I want this to be a comfortable experience for you so you won't be scared to come back. Okay. Alright, and then one blackhead, right? Okay. That one's giving me some problems. Okay, I'm gonna have to nick the skin a little bit on that one. Just a little pinprick. It should not hurt. I'm just going to prick it right there. Okay. Now I'm just going to take some tissue. This is the proper way to do it at home when you do it too. To wrap the tissue around your fingers. Okay, I'm gonna stand back. Okay, throw these away. And finish the rest of it with the extractor. Okay, perfect. Very good. Okay, now I'm just going to work on your nose a bit. The nose is the more sensitive area, a lot of cartilage there. So just let me know if it gets too rough for you, okay? And I'll stop. Okay. Yeah, you've been a trooper this whole time. Okay. All right. Yeah, the steam really helped. I'm not having any trouble at all, so I know it's a little sensitive because it's your nose, but shouldn't get too painful since it's all being so easy for me. Look up just a little bit. I need to get it right there. Okay. How's that feeling? Okay, good. Alright, one more. And then I'm gonna go over the ointment with you. Alright, perfect. Okay, just throw this away. And first I want to clean those areas that I went over again. This is just regular plain rubbing alcohol, no additives. No additives in this. This is just going to clean any germs and bacteria from those extractions, okay? Alright, just close your eyes for me. Yeah, cleaning along that hairline really well. Because I know there's always oils in your hair, no matter how much you clean it. In fact, the more you clean it, the more oils there are. Alright, cheeks. Of course, look up please for that. Jawline and chin. Okay. Of course, along your nose. Alright, good and clean there. Oh yeah, this is going to be easy to take care of. You're going to be clear in no time. Yeah, well, for most people, Retin-A works pretty well, but if it isn't working, we'll know within a few appointments, and we'll just move on and try something new, okay? Yeah. So this is what I'm going to start you with, and I'm going to go ahead and put just a little bit on the problem spots that I had today. Just to get you started. But then at night when you go home, I want you to apply this to your face and problem areas every night, okay? Alright. So let me just put a little here. And on this one here. And then, thank you. Get one right there. Yep, I'm just doing one quick look over on you. making sure I didn't miss anything obvious. Yeah, I think we are going to get this taken care of in no time. Yes, well, thank you so much for coming in. I would like to see you again in 2 weeks. Right, if you'll just make the appointment with the receptionist for me. And I am prescribing you this Retin-A and a topical ointment that's going to keep your face nice and loose for me on that next appointment. And for the first 3 or 4 appointments, I'm going to want to see you every 2 weeks. But then, depending on your progress, we'll probably lessen that and maybe do once a month and once every 2 months. And then we'll just go from there, okay? All right, wonderful. Let me just get this sheet for you. And you just give this to the receptionist and she'll take care of everything, okay? All right, thank you so much. You have a wonderful day. Yep. I'll see you in 2 weeks. Bye-bye.